COVID-19 hospitalizations are on the rise, and health experts are advising people to consider masking up again.
Jen Sullivan has a look at the latest health threat and what you can do to keep your family safe.
You may want to dust off those masks and keep them close by. That's because COVID-19 hospitalizations are on the rise.
We're at this inflection point. Numbers have been going up. Weather's going to get cooler and drier. They're probably going to go up a little bit more.
CDC data shows COVID-19 hospitalizations have been increasing since early July. But over 5 weeks, those numbers have nearly doubled to 13,000 new admissions. Earlier this year, the U.S. Centers for Disease Control and Prevention stopped counting new COVID case numbers and instead relied on hospitalization numbers. That's why some health experts are now recommending people in high-risk categories mask up. There is some good news, though.
Most of the country is considered low risk.
But for people in the yellow or orange areas, the CDC recommends masking for those at higher risk, especially if you're elderly or immunocompromised. Health officials also recommend testing before seeing someone who is high risk, and wear a mask indoors if you're with someone who has a greater risk of catching the virus.
I recently visited my parents, for example, in Florida. I wore a mask. I tested ahead of time, try and keep them safe.
If you're experiencing COVID-19 symptoms or have been exposed, it's important to test twice.
Sometimes people get that first test, think they're in the clear. That may not be the case.
And if you do test positive, the CDC recommends staying home for at least 5 days because that's likely when you're most contagious. I'm Jen Sullivan reporting.